I'm Sabrina Ganaway. I've been an employee at the North Mississippi Medical Center for 42 years, going on my 43rd year. 32 years of that was in the NICU as a bedside nurse, and the last 10 years I have spent as a certified lactation consultant, and now I'm a designated consultant for the NICU. The golden hour is a concept that has been researched and studied and became the new standard of care, the way we do newborn baby care. So it's not necessarily an hour, but that's the way we start it. And where most people are used to, we used to whisk the babies over to a warmer, dry them, the babies are screaming and carrying on, and they got a visit with the mothers, and then they were whisked off to the nursery for 4 hours. We realize babies need to be with their mothers to transition better from the uterus to the outside life. So the golden hour lets the baby stay with the mother and the dad. We delay the visitors coming. It's not just about COVID these days, but we delay the visitors coming in, at least for the first hour, so that the baby gets to be with the mother and dad in a quieter environment. And that goes into what the golden hour is to set up skin-to-skin time with the mother so that the baby hears her heartbeat, the smell and taste and feel of her, helps the baby to recognize and go, oh, I'm with my mother, and if I'm with her, there must be some food close by. So it sets off bonding, a closeness, it de-stresses the baby, de-stresses the mother, and so what it is a way for the parents and the baby to begin to bond as a family, uninterrupted for the first hour. But we still have the birthday party with everybody else afterwards. The golden hour, like I said, is a name for that concept of that, but why we do it is the barbaric way we used to separate mothers and babies, we found was very stressful for a baby. We are mammals, and babies come out looking for their mothers, and separation from the mother is stressful. So a lot of research has gone into why we do the skin-to-skin that is part of the golden hour. The baby on the mother, the mother's chest warms up to keep the baby warm. Hearing the mother's heartbeat lets the baby know who he's with, who she's with, and the baby can go calmly into a transition period. And we've learned there's like 9 stages of developmental parts of what the baby goes through being with the mother. So why we do it is good science of transitioning the baby. They're more stable. The heart rate and the breathing is more stable. The oxygen requirements are more stable. The blood sugars are more stable if the baby's just on the mother's skin to skin for that time. And of course, hearing the mother's voice is a very important part of the developmental care of the baby. So what we've learned is what we thought we needed to do with equipment and warmers and drying babies can all still be done. The babies are observed very closely. The mothers just don't realize we're still doing our observations. But we dry the baby quickly and roll them over onto the mother's chest, put a warm blanket behind them, and we're still observing and watching, because very few babies need intervention other than that time with the mother for at least that first hour, because a baby's sleep cycle is about an hour at a time, and that allows the baby to quieten, to get the breathing and the heartbeat under control, and to de-stress and be able then to transition into the lights of the world, the noise of the world, and all those things. And that's why the golden hour is actually extended with this use of the skin-to-skin time. Believe it or not, that golden hour starts immediately after this baby's birth. Unless there's a medical reason, we don't move the baby away. We go from delivery up to the mother, dry the baby just enough gently, turn that baby over, cover you up together. So the golden hour starts within the first 5 minutes of birth. And so we try not to interrupt. That's where we get the term the golden hour. But that's just a start of what we're going to do and our standards of care that have improved to make the birthing and the delivery process quieter, calmer, more stable, and a little bit more enjoyable for moms and dads to get to have their uninterrupted time. Now, the delay of visitors in the past was a big issue because everybody's waiting, and we've been used to that. So I know in this time of the pandemic, we have our visitation restricted, but when that's lifted, we're going to go back to having that birthday party where everyone can come in and view, but not until after that golden hour, or hopefully until the first feeding has been accomplished. And so as families have learned that this is better for the baby and some advantages for the mother and that family unit, everybody's been more patient to realize, I'm still going to get to see this baby. We enjoy being a part of your birthday party, and we feel it an honor to be a part of the golden hour to make that transition for your baby be something more of a pleasant experience than be so interrupted and so loud and boisterous as we used to be. We're going to have a quieter birthday party. If you have questions about the golden hour, you can talk to your obstetrician about it. Talk to our nurses when you're admitted into the labor and delivery area. We have brochures that you may get at different times or visits that explains the golden hour. And if you have questions, call us. We don't want anybody to feel concerned about what's going to happen. We want to answer these questions, but I can assure you, this golden hour is for your benefit and for the best benefits for your baby.